Subscribe to our channel by clicking the subscribe button. Click the bell button and enjoy the latest uploads from our channel.
Abdominal problems can have many faces. You can either suffer painful cramps or have distressing nausea. Not just that, these abnormalities can also lead to different forms of other physical ailments or manifestations. Ascites is one such physical ailment caused due to problems in the abdomen. Medical science states that ascites is an advanced stage of a malfunctioning liver known as cirrhosis, because of which fluid gets retained in the abdomen. In other words, we can say that ascites is a disease wherein fluid in the color of pale yellow gets accumulated in the abdominal cavity. Now, as abdomen is one of the basic functioning organ of our body, it is important to know the symptoms of ascites so that we can detect it at an early state. In this article we will try to explain a few of such symptoms. Various symptoms of ascites. Number 1. Bloated stomach. A bloated stomach is a common sign. But it is important to identify between a stomach that has bloated due to indigestion and a stomach that has ballooned because of fluid retention. People often confuse seeing an enlarged tummy thinking it to be a symptom of indigestion or flatulence. But if not properly examined, it could turn fatal. It has been stated by doctors that people suffering from ascites tend to have a life expectancy of only 4 to 5 years. So if you see that your stomach has become big unusually, do consult a doctor instead of jumping into conclusions yourself. Number 2. Shortness of breath. Shortness of breath can be due to many reasons. You could be overweight, you could have a heart malfunction. But in case of ascites, you will observe that a heavy pressure will be exerted on your diaphragm. It happens when fluid gets stored in the abdominal sac and is not excreted out. This can cause breathlessness. So if you observe that you are having difficulty in breathing, or heartbeat increases and you experience pain in the diaphragm walls, you need to see your doctor, as it could be a probable symptom for ascites. Number 3. Problematic liver. Liver is an important organ for the human body, but when it goes wrong it can cause many diseases. One such symptom of identifying ascites is improper liver. There are manifestations of liver diseases. Fluid retention is primarily because of a defective liver. So if you have a liver that does not function normally, it is better to go for regular checkups, as you could end up having ascites. It is more important because ascites is not very easy to detect in the early stages. Number 4. Feeling uneasy or restless. This is a very common symptom, and as mentioned in the previous symptoms, you can confuse it for any other disease. When the tummy gets bloated, it exerts pressure on the outer walls of your belly, because of which you look disfigured. This can be very serious for people who are conscious of their appearance. A bloated tummy will make you look bad and unshapely. This leads to unwanted tension, causing uneasiness or restlessness. You continue to think of ways to get rid of your bloated tummy, which you assume to be because of food indigestion. As said above, ascites cannot be identified in its premature stages. So if you happen to feel restless at a time when your tummy has bloated, do consult with your doctor. Caution: please use home remedies after proper research and guidance. You accept that you are following any advice at your own risk and will properly research or consult healthcare professional.